But there are opportunities for pharmacists in the realm of diabetes. Becoming a diabetes educator allows you to take care of the bigger picture of the diabetic residency. Will help you if you want to do that. I can see how having a pharmacist as a place a patient would stop to talk to a patient who has a polypharmacy problem would help in a heart clinic, in a psychiatric clinic. It would fit. It would take time, it would save time of the doctor so they don't have to explain it.
Do you think having that residency should give him an advantage?
No.
Why
All
not?
that matters is you've got a license on the wall, especially in a retail setting.
It's just finding that critical number when there's still benefit to adding residents, and it's not detrimental either to the other residents or to the pharmacists getting their routine job done and providing good patient care. So in general, I believe, and we have adopted a belief of kind of like this layered learning model where I can have a student, a PY4, a PGY1, and a PGY2 on rotation with me as a precept. There's a lot of synergy with that. The PGY2 teaches the PGY1 and the student, the PGY1 can teach the student, and they probably learn a little bit more, and it's just kind of like some of the basics, and they probably learn a little bit more themselves when they have to teach it to someone else. Yeah. So it's good for them as an individual, and then it saves me time so I can be doing other things. So it's a matter of, could I alone do that for 2 people and do it really well? Probably not. So I need to make sure before we grow the program that we have a good group of clinical pharmacists invested in training.
So the first thing to do is just kind of get out there and see what's available, see what do they have that's unique. So something that stood out about Kroger was I'm very diabetes oriented and I like diabetes. So they have a diabetes program that they were working to initiate. So that was something that stood out to me. And so a lot of times at these things, people want you to ask good questions. So they don't want you to ask like typical things that you could probably easily have found out on their website. But good questions like what makes your site unique, and what is something that your site does that others don't, that I would want to choose your site. And so that was something that Kroger had. CAR also, the CAR in Chapel Hill had the opportunity of TAing here at the school if that's something you're interested in, so a connection with the school. Whereas like my other co-residents at Moose and Rome Huey, they're not as close to the school, so they don't get to do as many things with the school.